Hi everyone, Dr. Jima here. Today we're gonna do something very different. I have a very close friend of mine here, and we're gonna talk about some of our experiences in pursuing our careers as physicians. I'm gonna invite Dr. Forrest to tell us a little bit about herself.
Thank you so much for inviting me. Thank you for having me. Again, my name is Dr. Soraya Forrest, and I am a family medicine physician. Just some background information about me. I am originally from Queens, New York, and I went to high school in Queens. I went to undergrad at Oakwood University, which is in Huntsville, Alabama. And after graduating from high school, I went to Ross University. And it's as a result of going to Ross University where I was able to obtain my medical degree. And following that, I started my residency in family medicine. I completed that last year. In August will be 1 year since I have been practicing as a family medicine attending.
So, how long did it take you from your journey? If we were to start from college, and you can start from high school, that's fine. But from college up onto becoming a full-fledged, attendant post residency.
Mercy. So let's just start after college. So graduated from high school, went straight through to college. So I graduated college undergrad in 2010. So from 2010 up until I graduated residency last year was 11 years. 11
Wow,
years.
wow, folks. So, no, before you continue, Dr. Forrest here. Now, a lot of young kids would say, it takes a lot of time to become a physician or to go to school. We may have a listener who is maybe 17 years old, 18 years old, somebody finishing high school. They have the aspiration to want to become a physician, but then
Mhm.
to look at all the numbers of years they have to be in school, and they're like, this is too much. It's going to take a long time. In your own perspective, how long does this 11 years come by? How fast? How slow? Like, tell us a little bit about
Slow. It flies by. I'm trying to actually think. I can't remember who exactly, but it was someone who was in medicine as well, who, when I was starting my journey, they told me this and it always stuck with me. They said that everyone eventually, as long as you keep living, you're going to be 30 or you're going to reach the age of 35. So even if you decide to take a career that's longer and the years of education are going to be longer, you're still going to get older, you're still going to age. And so why not spend the time, if you really want to do medicine, spend the time building who you are, building your education, building yourself and your career. And then, yes, although you would have gotten a late start because everyone else might have started, or a lot of people might have started their career a lot earlier, once you finish, you're finished.
That's actually a very valid point. If I heard you right, I think the point here is there are no shortcuts. If this is something that you want to pursue, you want to embrace yourself and you want to go through with it. There are no shortcuts because it may take you 10 years for somebody to also pursue something totally different from medicine, a different career, or do nothing with themselves and may or may not be happy after 11 years, right? So that's a very valid point. Now, what are you doing right now? What is your specialty?
So my specialty is family medicine, and right now I'm only seeing adults, so adult male, adult woman, and as a result of being a family medicine physician, I have the capacity and the ability to be able to talk to and have conversations with my patients about contraception, the best form of contraception for them. I do have experience with placing IUDs, and along with that, managing chronic illnesses and even having the opportunity to talk to patients about different things that they can do to help prevent these chronic illnesses as well.
So you focus a lot of on disease prevention and obviously intervening with chronic care and acute care as well. What really gives you your motivation? What makes you sleep well at night after, an exhaustive day of seeing so many patients? Like, what makes you happy about what you do?
Well, a few things, but one of the things that I really enjoy is when I get specific feedback from my patients and they tell me, Dr. Forrest, in all the years that I've been seeing different physicians, I've never had someone explain to me what's going on with my health and giving me the opportunity to really understand what's happening and what I can do differently. So knowing that a patient walks out of my office feeling empowered, even if the day has been going crazy, really just brightens up my day and reminds me that I'm doing the right thing.
Excellent, excellent. Would you agree that this is actually one of the reasons why perhaps you pursue this career, to be given that wealth of knowledge and to be in a position to offer significant help to others?
Definitely. And, just coming from the background that I've come from, my family, both my parents grew up in Haiti, from Haiti, and moved to the US well into their adult lives. And I know what it's like to have to help a parent navigate the healthcare system, which can be very complicated and things like that. So majority of the patients that I take care of are immigrants as well, some from different Spanish countries, and a lot of times I'm using the interpreter, but I, from my own experience, know how important it is to make sure that the patient just knows what's going on and the time is taken to explain that, and they really appreciate it. And so being able to teach, even though I have to use an interpreter and it takes a lot more time, they appreciate it. And at the end of the day, knowing that I'm investing into their health and they're also able to do the same is very rewarding. And it's definitely the reason why I decided to choose a career in medicine.
Excellent. Now, what would be an advice you would give a high school student? Now, I want you to try to answer this question for our audience, looking at some of the challenges or the obstacles or the successes in college. Because as a high school student, your first barrier or your first challenge you need to overcome is the college, in anticipation to becoming a physician. So what would be your advice to a high school student?
I would say definitely be flexible and definitely be open to learning from anyone who's willing to teach. And so I always did well in school. I wasn't at the very top of my class, so I was never valedictorian or salutatorian, but I did well. And really in high school, I never really had to study, but still did well. And so one of the things that I learned in college was that I did not have good study techniques. So I learned that in college, but I still wasn't sure how to develop that. And I learned that from one of my roommates. I believe we were either sophomores or actually we were juniors. And I tell some of my friends this as well, but I woke up maybe at like 4 or 5 o'clock in the morning to use the bathroom, and her light was on. So I kind of gently knocked on the door, and she was awake, and she was sitting at her desk. And so I was completely shocked, and I was like, well, what are you doing up? It's 4 or 5 o'clock in the morning. I was coming in to turn off your light. And she's like, no, I'm studying. And it was maybe it was like still orientation. So I was like, what are you studying? She was like, oh, went through all my classes, looked through all the syllabi, and I'm pre-reading. And I was like, what? I'm like, girl, class didn't even reading. You should be enjoying, chilling. Like, what are you talking about?
So it's stop you, but I just want to let my viewers hear this. So basically, this is somebody that was very keen at making sure they would succeed in college, and they had so to speak, the type A quality. I could tell.
She was very disciplined. She was very disciplined. And that stuck with me. I promise you, that stuck with me forever. And I was just so shocked because, again, it's not like we were a month into school. We were literally within the first week. It was still orientation. People were still getting settled in, and she was going hard. And she ended up being valedictorian. And that just goes to show you that it's never too late to adapt new study habits. You never know who can teach you those new habits or new ideals or whatever it is. And again, that stuck with me. So even transitioning into medical school, where someone else, a woman from our church, told me she was an NP, but she said, I didn't go to medical school, but what I've heard is that medical school is like trying to drink water through an open fire hydrant. So that amount of water and that force of water is just hitting you, and your mouth is not wide enough. There's no room to catch all of it.
100%. Before we proceed there, because we're going to jump into medical school and some of the challenges that comes along with it. So if I understand you right, basically what we are hearing that is that medical school gives you a plethora of information, like lots of information, and you have one single brain to adapt all that information within about 4 years, right?
Mm-hmm.
All right. So, how did everything pan out for you as an undergrad? And from what you learned from your friend or your roommate, and what was your major?
I was a biology major. I was a biology major in undergrad, and things that, in retrospect, I learned was that because I didn't know many people or didn't have any mentors in the field, I didn't take the time early enough and didn't have as much resources as I should have to better prepare for the MCAT. So the MCAT was an area where I didn't do well. But in medical school, I met some people, and you start talking, everyone's at Ross, so okay, well, what happened? What are you doing here? So there were people who did really well on their MCAT. And some people said, well, no, I did really well, but my GPA was just, I didn't do well, doing other things, not really focused. But when it came to the exam, they were able to just really kill it. And so had a few conversations. Well, what did you do? And I remember someone said they did over 10,000 practice questions. And I said, what? I said, 10. I said, how did you even get access? Like, where did you get those 10,000 practice questions? Like, yeah, I did literally every review course that offered questions, they did it. And I was completely blown away.
And to our audience, this is not atypical in our field, especially when we are learning, getting ready for these exams.
Mm-hmm.
I quite remember the MCAT, if I'm not mistaken, was over an 8-hour exam. Yeah. It feels like a long time ago, but not that long time ago. And very extensive, very exhausting. And this is this part of our training. But so for you, what would be your advice for somebody, in college right now who is a biology major, biochemistry major, English major, math major, whatever the situation may be, that is considering getting into medicine now, preparing or planning in advance with the MCAT is a very valid point that you brought up. What would be your advice to somebody at that particular stage in their life?
I would say definitely know the reason why you want to pursue this career. What is your purpose? And what I've found is that a lot of people will pursue the career in medicine because that's just what their family wanted them to do. And so as a result, when things start to get a bit challenging, you can't really pull or push into reminding yourself, okay, well, this is the reason, your motivation, this is the reason why, I have this particular purpose that I know I'm destined for. If you're just doing it just to do it, that's really going to be quite difficult to hold on to or to use as motivation when you find yourself in trying or difficult situations. So definitely knowing the reason why you want to pursue a career in medicine and knowing your purpose in life in general, I think is really important.
And you bring up a very valid point, because personally, I would agree that our career in medicine really has a lot of obstacles, um, depending on how you see it. Challenging, things that are, established to basically make us as sharp as we ought to be. Um, with that being said, if you are not ingrained in your own philosophy or concept of motivation of becoming a full-fledged physician or whatever specialty you want to be, then you stand a chance of not going through, which does happen. But majority of people are able to kind of go through this. What would be your advice for somebody that has made it through college, passed the MCAT, or got into some sort of medical school program? What would be your advice to them? Because that also comes with a challenge, like you said, the number of exams you have to take,
Mm-hmm.
the countless nights where you don't sleep steady and all that stuff. And what would be your advice to them, being on the other side now?
Well, so for those who are about to start medical school, definitely do not be afraid to ask for help. So once you're in, right? So the guard in a sense can come down. You are in, so now you have to make sure you stay in. Medical schools typically have, once you're in, the resources are available to you, but you have to know when to use them. Don't wait until the night before or the week of an exam to go to your peer tutors or whatever tutors to see your counselors and things like that. If you are just feeling drained, you need motivation, reach out to people in your class, have a study group. Dr. Jima and I met that way. We were in, was it, I think it was respiratory physiology. Respiratory physiology. And I don't remember if he said something to me first or if I said something to him first, but we were just like, oh my goodness, we got to get together and talk this thing out because this is not going to take us out.
It's not going to work
Okay?
out if you want to go solo here.
Exactly. And so that's how our friendship started. Literally, our first semester at Ross, forming a study group, and we have been connected ever since. So the people that you meet, the people that are in your class, whether they sit in front of you, behind you, start a study group. Keep each other motivated, and that's really what will definitely help carry you through.
And I would like to add to that it is not a competition. Like you said, once you're in, you're in. It's a matter of developing, the relationship with others around you, depending on other people's strengths, and you also providing your strength to other people and growing together. It has a lot to do with learning, and learning new things, um, expanding your brain capacity to a different level. But there's a lot that has to do with just interpersonal relationships, building friendships, and developing a very healthy way of relationships and communication. So I will add that to it. Now, fast forward, how about somebody in residency? Now, I would echo what you said earlier. Once you're in, you're in. You just gotta stay in. What would be
Gotta stay
your
in.
what would be your take on a new resident who is starting?
As a new resident starting, the same concept in that now that you're in residency, you have your peers, you have your seniors who were literally just where you were 1 or 2 years ago. If you are struggling, do not struggle in silence. Ask your peers, talk to your peers. These exams continue to follow us. So even in residency, you have your ITE exam. So usually every specialty has it.
Well,
You have your
let me say this: the
Mhm.
IT exam that Dr. Forrest was talking about is basically an in-service training exam. I'm sorry.
Right.
Yeah, I'm right.
Hmm. Exactly. It's been too long for him. He completely forgot. Yeah, exactly. So you have the exam comes, and the exams is supposed to show basically how ready you'll be for the board. If you do well, great. If you don't do well, usually maybe your program director or whoever will talk to you. But if you're struggling in that area, talk to your peers and say, hey, what have you been doing? I'm struggling with this. What have you been doing anything different? And then when it comes to the actual practical aspect of what you're doing of medicine, the more you see, the more patients you see, the more you'll learn. And so as you're seeing your patients, once there is a diagnosis that you're not aware of or a workup that you're not familiar with, you look it up. You look it up, and every time you see a patient with something similar, you'll continue to remember that information that's relevant to that patient, and that's how you continue to learn and build your knowledge base.
That's absolutely true. So um, there is some method to the repetitiveness of the cases that we see.
Mm-hmm.
And as residents, we tend to see a lot in the hospitals, outside of hospitals. So I guess the key here is applying ourselves to the cases that we do see, spending the time at that early stage to really read more about it, getting ourselves very familiar with the process so that we can be efficient or proficient, 2, 3 years down the road. And I would say that being in practice, majority of the cases that I'm seeing now is not any different from what I saw as a resident. I'm just more proficient now. What would you say?
Exactly. Exactly. I mean, there's a few times where you might see a few rare cases where, I might send a text to Dr. G, have you ever heard of something like this? But for, again, majority of times, it's the cases that you were seeing throughout residency. So you're familiar with the workup, you're familiar with the diagnosis, you're familiar with the steps that the patient has to take to prevent this from worsening and things of that nature. Don't think that what you're doing on a daily basis as a resident isn't important. It is very important.
Absolutely. And you're going to meet so many different attendants who are there to help you. Some may not have the best style of teaching, but the take home here is that you're in a learning mode. So you just want to take the best out of everyone you encounter to become the best of you. Now, Dr. Forrest, it's been a year now since you finished residency in practice. Like you told us, the things that really kind of keeps you going, keeps you motivated, is your ability to be able to educate your patients to a level where they can understand your patients connecting with you in a very unique way that kind of makes your job very rewarding. Would you say after a total of 11 years of training, this career path is worth it?
I would. I definitely would. And if I had to choose it again, I would.
Excellent. There you have it, everybody. That is an amazing answer. I love it. Thank you, Dr. Forrest. Do you have any more? If you want to, if you were given opportunity, just maybe in one sentence, say something to uplift our audience. Anybody listening, what would you say?
I would say that no matter what career you're in or what field you're in, life is definitely going to present itself with challenges. And you might find yourself feeling just pretty weighed down with life in general. But just know and remember that you have everything it takes to be able to overcome the challenges, overcome the difficulties, and be exactly where you want to be.
You know, if I'm not poking too much, and I know I've known you for so long, so I feel comfortable saying this, but I mean, if I'm not mistaken, in your entire process, you had 2 losses of family members. And I got to say, I admire that a lot because that did not push you back. You know, you lost your dad, you lost your mom, while going through all these processes. So for any of our listeners listening to us, if you are going through any of those challenges and difficulties, just know that it is possible. What would you tell them, Dr. Forrest?
I would say definitely for me, everyone has their, I guess, their spiritual walk, or not everyone, but definitely my relationship with God is what kept me sound. It kept me just together and in my right mind when things literally were just falling apart. And
share those two instances for us, if you don't mind, in a very brief way.
Well, the first situation was when I was just starting my 4th year of medical school, and I was on my hematology rotation in Queens. And earlier that week, I actually just dropped my parents off at the airport. They were going to Florida. And so I was at the hospital, and I got a strange phone call from a random number, and answered it. And I was in the hallway, in between seeing patients, and it was one of the attendings that was taking care of my dad. And so my dad told them that I was a physician. So at the time, my name was Jean-Pierre. So he was like, "Oh, Dr. Jean-Pierre." And I was like, "I'm a medical student." He was like, "That's fine." He's like, "Look, I'm taking care of your dad, but he's very sick." And he's just cut right to it. He said, "When are you going to come to Florida?" And I was like, "What do you mean?" He was like, "You need to get to Florida." I'm like, "Well, let me, talk and see, I don't know, maybe in like a week or two." And he was like, "No, that's too long." And I was like, "Well, what do you mean?" He was like, "Yeah, you needed to be here yesterday." And so I said, okay, walked back in, spoke to the senior resident that I was working with, and I said, my dad is not doing well. As you can imagine, as I'm talking to him, it was just pure tears, just crying. I couldn't even get the words out. And he was like, "Just go." And he's like, "You need anything, call me." And that was the last time that I was at that rotation. I just withdrew from that rotation. We ended up going to Florida. My dad was sick for about a month there in the hospital, and then he ended up dying in Florida. And so withdrew from school just to kind of get my head wrapped around what was happening. My mom was handicapped at that time because of illnesses that she was going through. So I became her caretaker, and, trying to navigate that. I was studying for Step 2 CK and CS at that time. And it was a lot. And it was just completely overwhelming and just devastating to have all of that happen. And I actually didn't even go to my medical school graduation because I was just completely depressed. It was the following year, May. So it was almost a year after my dad died that we had the graduation, which was in Florida. And I couldn't bring myself to go. But thank God, even after all of that, I was able to pass my board exams. But with withdrawing from school, delaying my exams, that just kind of delayed everything, and so
yeah, but that's okay. Yeah, but that's okay.
But when you're in it,
yep, life happens, and I'm glad that Dr. Forrest is sharing this with us, because it's not a perfect system. It's not a one path for everybody. You just don't stay on one single path. Life throws itself at you, and it can become very challenging. How about your second event?
When you're in it, it feels so. Those are points in time where time goes by, but those are points in time where everything just kind of seems to slow down. Your life is on hold, but everyone else's life is just moving. And so it was pretty challenging. But one of the things that I just kind of pushed myself to do was reach out to people and talk to people. And as a result of that, one of my mentors put me in touch with an infectious disease specialist in Brooklyn. So I started doing some shadowing at his office. I started scribing at CityMD, and then I ended up studying to take step 3. So basically during that time off, after all of that was said and done, I was able to have step 3 done before I started residency. And then in 2018, March of 2018 is when I found out that I was accepted into residency. And then that's when I started. And then fast forward through residency, my last year of residency, my mom got really sick and she was in the hospital for a month. And I was third year. Whenever you're an inpatient, you're inpatient charge. When you're in clinic, you're outpatient charge. So inpatient charge, literally leaving the hospital after being there for over 12 hours and driving from Jersey to Queens every day to see my mom. And it was just like when you're just moving in autopilot like a blur. And that's literally what it was. And then I had the board exam. So in the midst of everything, had my mom died in the end of February, and had the board exam in April, and I was just over it. And I was like, well, maybe I should just take it in November, because I just completely drained and just ready to just give up. But I ended up taking it and I passed. And after that, it was receiving the residency diploma.
Well, think of tenacity, think of focus, think of purpose. I think those are the things that you've highlighted here. And, I want all our viewers to understand that, life is not a perfect system. Like Dr. Forrest just talked about, if I captured it right, towards the end of your medical school year, you had a huge obstacle that could have derailed you from fully completing medical school. Towards the end of your residency, you had another, significant life event that could have derailed you, because if you had not passed your boards, then you can't be a board certified family physician and practicing the way you want to. So that could have also derailed you. In both situations, you pulled through. Like you said, your faith, your family, and everything worked out. So everybody listening to us, we want you to just be reassured. Just stay focused, stay grounded, be steadfast in your faith, whatever drives you to get you through some of these things. Thank you so much, Dr. Forrest, for spending this time with us. I'm very, very, very appreciative. And I hope our audience will enjoy this amazing interview. If you have any questions, concerns, leave them in the comment section down below, and we'll be bringing more your way. Thank you, everybody.
Thanks for having me.